even know what to say here. This is one of the funniest chiropractor videos I've ever seen. Sir, carpal tunnel syndrome is compression of the median nerve at the wrist. Drilling a hole.
All right, let's clear this up. This is a drill, and this is a piece of wood. Let me show you what drills are meant to do. Now this is not a drill. This is my KH Laney 2, a precision instrument used in the orthospinaology procedures. Two completely different purposes. Let's have a look. Oh. No drilling there. I practice a specific form of chiropractic called upper cervical care, and it's nothing like traditional twisting or cracking of the neck as you may see. See, this instrument, it delivers a precise, gentle tap to the atlas, the top bone in your neck, or C1. So in that video, you probably saw the tool placed on the patient's earlobe. That's because the contact point, the transverse process of C1, sits just behind it. And for comfort, some patients prefer we go slightly higher on the ear or on the earlobe itself. Either way, the correction is made at the same structural point. So, and here's why that matters. The atlas directly affects the biomechanics of the brachial plexus, the nerve network that forms the median nerve, the one everyone associates with carpal tunnel. Even though the symptoms show up in the wrist, the real issue can start in the neck or even in the upper neck. And that's why carpal tunnel syndrome is often misdiagnosed. In many cases, it's actually cervical radiculopathy caused by a structural shift in the top of the spine. Focusing only on the wrist is like patching drywall in the house with a cracked foundation. Doesn't fix the real problem. At Foundation Chiropractic, we correct the primary condition, the misalignment at the cranial-cervical junction. No medication, no surgery, no side effects. Just gentle, precise corrections that help restore proper nerve function, often improving issues like vertigo, migraines, carpal tunnel symptoms, and chronic neck pain. You don't have to take my word for it. Here's that patient from that video sharing her story in her own words.
Hi everybody, I'm Taylor. I'm a local Tampa mom of two amazing boys. I want to talk about my experience with foundational chiropractic. So for the past decade, I have been going to different traditional chiropractors, which has been good and well, but it was a lot of guesswork. They just do a lot of twisting, cracking, popping, which really only relieved my symptoms for a few days. I found that when I came to foundational chiropractic and worked with Dr. Berner and Dr. Andrea, that I have had less anxiety, less brain fog, I'm less tired, less fatigued, and it actually helped my wrist pain, carpal tunnel, and arthritis in this hand especially. So what they do that's different is that they come right on my ear or behind the ear, on the earlobes just more comfortable, and they can still adjust your atlas that way, which I love, and it's a super comfortable adjustment, really gentle, even my kids get it, and it has changed so much for me. So I encourage you, if you're feeling skeptical about upper cervical care at all, give it a try. Thank you.